We did this to celebrate our 15th anniversary of the Travelers Institute, which is the public policy, educational, thought leadership arm of Travelers Insurance. And I have the privilege of leading it over the past 16 or so years. We've been celebrating this 15th year anniversary for the whole year. And I want to take just a 2-minute out to talk about what we've done in 15 years. Actually, I'm not going to talk. You're just going to watch a video.
15 years ago, Travelers established the Travelers Institute to lead constructive conversations about today's public policy challenges and tomorrow's needs. Since then, the Travelers Institute has leveraged our risk management expertise, convening audiences with government and industry thought leaders to share insights, learn together, and solve problems. We are proud to celebrate 15 years of educational initiatives, and we look forward to driving thoughtful conversations that help us all meet the opportunities ahead.
So thank you all for being part of the last 15 years, and now we're focused on the next 15 years. We're about the future, and we're future ready. We're innovative at Travelers, and so our programming has to be innovative as well. We launched our Forces at Work initiative for a reason. The goal is to help us all navigate through the really challenging workforce issues today. The topics we're going to talk about are on your screen, and over the next 2 hours, we're going to dig deep into these. We'll start off with a keynote address on the state of mental health in America and why it should matter in the workplace. Then session 1, our panel will help us determine as business leaders what we can do to promote mental well-being within our organizations. And we'll share insights from workers' compensation systems, of which we are the leader in the United States. And our thought leadership of workers' comp has been for many decades. And I'm going to call out my colleague Rich Ives and Nick Seminara for leading the way. So towards the end of the session, we'll begin serving lunch for those of you who haven't had enough already to eat. And then we'll have a very short break. So finally, session 2, we're going to assess today's labor market and what it means for bringing new talent, especially with a focus on technology talent. And my colleague, Mojgan Lefebvre, is going to lead that conversation. So before we get started, as always, I'd like to share a disclaimer about today's program. I also want to thank my incredible friend, Joe Tama, from the New York Stock Exchange. He gave me an overly generous introduction. I couldn't even get out my opening remarks. So whatever I said about an hour ago, I don't even know what I said. I was so overwhelmed with joy. He's an incredible friend. So Travelers is very proud of our history. We're the only P&C company on the Dow 30. And over the past few years, Travelers Institute programming has explored mental health, mental well-being, and we know what it takes to be successful at work. And that's why the topic of this morning is so important. So now on to our keynote address. We thought it only fitting to kick off our conversation with someone who has served as the nation's top doctor. Dr. Jerome M was the 20th U.S. Surgeon General, working at the forefront of America's most pressing health challenges. As former commissioner of the Indiana State Department of Health, he led the state's response to Ebola, Zika, and HIV. As the nation's Surgeon General, Dr. Adams was the operational head of 6,000-person public health service department, and he oversaw responses to 3 back-to-back Cat 5 hurricanes and a once-in-a-century pandemic. We owe him a debt of gratitude. Currently, Dr. Adams serves at Purdue University, where he's presidential fellow and the first executive director of Health Equity Initiatives, and at the Center for Community Health, Enhancement, and Learning. So please join me in welcoming Dr. Jerome M to the stage.
Thank you. Well, good morning, everyone. It is such an honor to be here today. Thank you, Joan and Travelers, for hosting us. Thank you to the New York Stock Exchange. And for those of you who need one more reminder, it is appropriate and ironic that I am here today, because it was almost 5 years ago that I crashed the stock market with COVID shutdowns. True story. And that's why it's even more of an honor to be here at the New York Stock Exchange. It's a place that stands as a symbol of the vibrance, the resiliency, and the potential of America. We thought times were bad. They were historically bad in 2020. We thought they were never going to come back, but the market went to the highest of highs after that, and it will come back again. And today I want to talk to you about something that impacts us all, particularly in these turbulent times, the state of mental health in America and its profound effects on our nation's economy. Over the course of my career, I've had the privilege of engaging in conversations with a wide range of people, from healthcare professionals to politicians, from business leaders to families. And one thing that I've learned is that mental health challenges are pervasive and they affect us all, whether directly or indirectly. And these challenges are not just personal, they're societal. From 2017 to 2021, I had the privilege of serving as your United States Surgeon General during a time when mental health was emerging as one of the most pressing public health concerns of our time. I approached the issue through my lens as the nation's doctor, but what I came to realize during my tenure, and what I've continued to witness in the years since, is that the state of our mental health is not just a medical issue, it's also an economic one. That's why it's critical that we understand the profound impact our collective mental health has on our workforce, our business, and our overall economy. So, why are we seeing the rise in mental health issues? And okay, first of all, I want to start with a couple of facts to orient you. The state of mental health in America, it's concerning, to say the least. Anxiety. According to the National Institute of Mental Health, anxiety disorders affect 40 million U.S. adults, or 18.1% of the population. It is the most common mental health issue, and its prevalence is only increasing in our current times. Depression. Approximately 1 in 6 Americans will experience depression at some point in their lives. In fact, it's one of the leading causes of disability worldwide, affecting 17 million adults in the United States alone. How many people are at each of these tables? About 10. So 1 in 5, 1 in 6 people, anxiety, depression. Suicide. Tragically, suicide rates have been rising in recent years, with the CDC reporting it as the 10th leading cause of death in the United States. More than 48,000 lives were lost last year. And what's even more troubling, particularly to me as a parent of a 20, a 19, and a 15-year-old, is the sharp increase in suicides we're seeing amongst young people. Suicide is now the 2nd leading cause of death for individuals between the ages of 10 and 34. And then finally, an issue that's deeply personal to me. Many of you have heard me share my family's story, substance misuse. Despite some recent declines, the opioid epidemic continues to rage across America, with nearly 100,000 Americans dying yearly from drug overdoses. Many of these deaths are tied to substance use disorders that stem from untreated mental health conditions like depression, anxiety, and PTSD. And we know that mental health disparities disproportionately affect certain communities. For example, LGBTQ plus youth face a significantly higher risk of suicide and mental health struggles, with suicide rates estimated to be 4 times higher than their heterosexual peers. In minority communities, especially Black and Latino populations, we see poor mental health outcomes partially due to systemic racism, cultural stigma, and disparities in healthcare access. And as we know, our young people are increasingly struggling with mental health challenges, with 1 in 3 adolescents reporting symptoms of depression and anxiety. I told you I have 3 kids. That means one of my kids, statistically speaking, is going to be suffering from anxiety and depression. So, why are we seeing this rise in mental health issues? Well, several factors contribute. There's the pressure of modern society, economic stress. We're at the New York Stock Exchange, social media, and the COVID-19 pandemic. And there's also an overall breakdown in community connections. But let's not overlook the role of politics in the media. In today's 24-hour news cycle, we're constantly bombarded with sensationalized headlines, divisive rhetoric, and a steady stream of doom scrolling that keeps our stress levels sky high. And the polarization in Washington, D.C. isn't helping either. If you've turned on the news lately, you've probably wondered whether Congress itself should be going through group therapy. Yet the dysfunction, the gridlock, and the political infighting, they don't just shape our policy, they shape our collective anxiety. When every issue is framed as an existential crisis, a very threat to our lives and to our livelihoods, it's no wonder so many people feel overwhelmed. Our fast-paced, high-stress world, combined with a lack of proper mental health support and support for each other, has led to what is a national crisis. Now let's consider the cost of this national crisis. It's not just in terms of human suffering, but in terms of its impact on the economy. According to the World Health Organization, depression and anxiety alone cost the global economy $1 trillion annually in lost productivity. Someone tell Elon that he could save a whole lot more money if we focused on mental health issues right now. In the United States, the economic impact of mental health disorders is staggering. Mental illness contributes to over $200 billion in lost earnings every year due to workplace absenteeism, reduced productivity, and disability claims. But the true cost, it extends beyond direct impacts on the workforce. It's also about healthcare spending. Treating mental health conditions, including substance use disorders, comes with a hefty price tag. Direct U.S. healthcare costs for mental health conditions, including treatment for mental illnesses, substance use disorders, and related comorbidities, are estimated to be about $210 billion annually. And much of these costs are borne by employers. Moreover, when individuals suffer from untreated mental health conditions, their ability to contribute to the workforce, to participate in the workforce, diminishes. People leave their jobs or they experience long-term unemployment. And even when they stay employed, the toll of mental illness can mean reduced productivity, poor decision-making, and higher rates of turnover. So, what can we do to reverse this trend? Because it is not all doom and gloom. Employers play a crucial role in fostering a workplace environment that supports mental health and overall well-being. To minimize workplace stressors, organizations can promote reasonable workloads. They can encourage work-life balance. They can create a culture where employees feel safe discussing mental health without fear of stigma. Beyond just reducing stress, companies can proactively build resilience by offering access to mental health resources, implementing employee assistance programs, and providing training on stress management and emotional well-being. Additionally, recognizing that external stressors, such as financial struggles, family responsibilities, and societal pressures also impact mental health, employers can offer flexible work arrangements, financial wellness programs, and community support initiatives. By prioritizing mental wellness, businesses not only enhance productivity and engagement, but also contribute to a healthier, more resilient workforce. This is why we must address mental health proactively by integrating mental health support into the workplace, by advocating for policies that expand access to care, and by fostering an environment of parity where our mental health is prioritized and paid for to the same degree as our physical health needs. But we also need to address the societal factors that contribute to mental health struggles. And that brings me to my final point, and one that's been on my heart a lot lately, the power of civility. You might be wondering, what the heck, Dr. Adams, does civility have to do with mental health? Well, my answer to you is a great deal. It goes without saying, our nation is deeply, deeply divided right now. Political polarization, our social media echo chambers, and rising tensions have created a climate where anger and vitriol often replace understanding and empathy. And while it's easy to see how this affects our political discourse, it's important to recognize the toll that it's actually taking on our collective mental health, each and every one of us. Civility, the simple act of showing respect for one another, even, or dare I say, especially when we disagree, is critical for our emotional well-being. When we live in a society marked by division and discord, it increases our stress, our anxiety, and our feelings of isolation from one another. People begin to feel unheard, unseen, and disconnected from their communities. This not only worsens mental health outcomes, but it makes it more difficult to address complex issues like mental illness and substance misuse. But there's good news here. Civility can be a powerful tool for healing. When we engage in civil discourse, whether with a colleague, a neighbor, or a stranger out on the streets of New York, we create space for mutual respect and understanding. Civility allows us to break down barriers, to build trust, and to move towards solutions that address our shared challenges. In my own career, I've seen firsthand how civility can impact health. I'm going to share with you one quick example. In 2015, before I was Surgeon General, I was the Indiana State Health Commissioner when we faced an unprecedented mental health and public health challenge. A staggering number of people in rural Scott County, Indiana, had become infected with HIV caused by injection drug use. The public health solution was clear. We needed a needle exchange program. But that solution was highly, highly controversial, especially in such a deeply conservative state and a deeply conservative community. We could have forced a governmental solution. I could have used my authority as health commissioner to simply demand that we open up a syringe service program. But instead, we chose to approach the community with respect and with understanding. We listened to their concerns and engaged in a civil discourse with local leaders, even those who opposed the program. We found common ground, we built trust, and ultimately implemented a policy that saved lives, not just in Scott County, but through the expansion of harm reduction programs across rural and conservative America. It remains one of the things I'm most proud of in my career. So I speak from experience when I tell you that this same approach, an approach rooted in civility, can help us improve mental health in this country. By fostering civil conversations about mental health, we reduce stigma, we encourage people to seek help, and we create policies that truly address the needs of those suffering. So how do we cultivate civility in our everyday lives? How can you build a society where respect, empathy, and understanding are the norms and not just the exceptions? Well, I'm going to close by sharing 4 practical steps that I believe can make a meaningful difference in how we engage with each other and how we tackle complex issues around mental health. Step number 1, listen actively. In a world where everyone has an opinion, it's easy to speak without taking the time to truly hear others. But to foster civility, we must make an effort to listen actively. This means really paying attention when someone speaks without interrupting or forming our rebuttal. And my wife is watching on the live stream right now. Lacey, I'm trying to do better at this. Listening shows respect, and it helps build our mutual understanding. Number 2, choose your words wisely. Our words can build bridges, or they can tear them down. In times of disagreement or tension, be mindful of the words you use and how you communicate. Language that is respectful, even when challenging an idea, encourages dialogue and doesn't alienate others. So choose words that foster understanding and not division. Number 3, practice empathy. One of the most powerful tools we have in fostering civility is empathy. We should try to see things from others' perspectives, especially when those perspectives differ from our own. Empathy allows us to connect on a human level, reducing the judgment and stereotyping that often fuel discord and disconnect. One of my favorite quotes is from Mark Twain. He says, travel is fatal to prejudice, bigotry, and narrow-mindedness because it opens your eyes to how other people see and exist in this world. Number 4, encourage constructive debate. Debate is a cornerstone of our democracy, but it must be done respectfully. Instead of attacking individuals, focus on ideas. Instead of criticizing people, critique policies. Encourage open discussions that challenge your own views in a constructive way. Healthy debates lead to deeper understanding and better outcomes for everyone involved. So what's my final Surgeon General's warning on mental health? Well, we must invest in mental wellness, and we need to make mental health care accessible to everyone, regardless of their socioeconomic status, geographic location, or demographics. Employers, you all can play a huge role by prioritizing mental health in the workplace and offering the full spectrum of mental health support for your employees. And we need to commit to civility. Let's work to rebuild a culture of respect and of understanding. Remember, civility isn't just about being nice, but about building healthy and prosperous workplaces and communities. It doesn't just lower stress and anxiety, it fosters collaboration, innovation, and problem solving, which are critical to get that stock market going in the right direction again. Finally, let's all remember that mental health, it's not just the job of the Surgeon General, it's a shared responsibility. We must act together to create an environment where everyone, regardless of their background or identity, has an opportunity to thrive. You always harvest what you plant. Maya Angelou said that. So I challenge you to choose the seeds that we sow in this world and in our workplaces carefully. And I thank you for giving me the privilege of your attention today and of serving as your United States Surgeon General from 2017 to 2021. Thank you very much.